This is Chicky Flowers. My pronouns are she, her, hers, and Shakanya, and it is October 16th, 9:05 a.m. Welcome to the Health Insurance Marketplace Advisory Committee. And I will officially pass the mic off to our chair, Lindsay.
Hey, good morning. Can you hear me okay?
Yes, we can.
All right. Welcome, everyone. Thanks for being here. I think we should jump into roll call if it looks like we have critical mass. I think we do.
Yes, we do. And that is my cue. So if when I call your name, please let us know if you are here at the meeting. And let's start with our newest member, Mary Ariola.
Good morning. Thank you, Chicky. Here.
Gladys Batwell. Stacy Carmichael.
Here.
Good morning. Charlie Fisher.
Here.
Ron Gallinet.
Here.
Paul Harmon.
Here.
Lindsay Hopper.
Here via Zoom.
Thank you. TK Keene will be joining us a little later today. Kathleen Orrick.
Here.
Claire Pierce-Robel.
Present.
Thank you. Om Sakinai.
Morning. Here, Zoom.
Good morning, Om. Neshoba Temperley.
Here. Thank you.
Joanne Zembrennan.
Here.
Thank you, everybody. We definitely have more than quorum today. Chair Lindsay, back to you.
Thanks, Chicky, and thanks everyone for being here. Happy October. The summer has gone quickly. I think we're headed into meeting guidelines. Next slide, please. So our goal here and our commitment is safe and inclusive meetings for everyone. We are all here to bring our opinions and experiences and those we work with. So we are very open to questions and ideas. Nothing is silly. We'd like to hear everyone's perspective. If you have a question or you'd like to comment, if you could please raise your virtual hand if that functionality is working for you, or put it in the chat. If you do chime in with a comment, please don't forget to say your name. It's helpful. And we do have interpretation rolling, so thank you. And let's be considerate of that so the pace is workable for interpretation. If you can be on camera, please do so. And we'll be logging votes and through our usual practice. Next slide, please. Covered the name. If you're a member of the public joining to listen, please wait until public comment. We have several of those. And of course, if you experience anything unacceptable or you have any concerns about behavior, please reach out to Chicky. We certainly want to hear from you. Again, we want everyone to feel comfortable participating. I think next meeting minutes. Okay. So the July minutes are in the packet. Does anyone have a motion for approval?
I'll move approval of the minutes as presented. This is Ron Gallinet. Sorry, I'm losing my voice a little bit.
Thank you, Ron. I hope you're feeling okay. Hang in there.
I am.
Okay, good. Is there a second?
This is Neshoba Temperley. I move to second.
Thanks, Neshoba. Any discussion, questions, or comments on these minutes? Okay, then I think Chicky, will you call the vote, please?
I will, and so I will assume that those who are not able to join the last meeting, either because you are a new member or just was not able to join, that you are going to be abstaining. So Stacy, how do you vote?
I move to approve.
Thank you. Charlie?
Yes.
Thank you. Ron was first motion. Paul, how do you vote?
Approve.
Thank you, Lindsay.
Aye.
Kathleen Orrick?
Approve.
Thank you, Kathleen. Claire Pierce-Robel?
Approved.
Thank you. How do you vote for the minutes?
Yeah, approve.
Neshoba, you were the second motion, and Joanne, how do you vote for minutes, please?
Approve.
Thank you very much. Lindsay, the minutes for July is approved unanimously.
Thanks, everyone. Appreciate it. I'm sorry, Chicky, I know TK's hoping to join a little later. Did you want to defer the welcome? Maybe I misunderstood.
Maybe we can start, we can go with Marin, and then when TK is able to join, we can go back to the welcome for TK.
That sounds good. Marin, do you mind sharing just a little bit more?
Sure, yeah. No, thank you for having me here, by the way, and thank you, Chicky, and of course the governor for appointing me to this committee. So my name is Marin Ariola. I'm president of Advanced Economic Solutions. We've been around for 22 years here in Oregon. We work with affordable communities, but also general communities in the area of economic development, workforce development, supply diversity, and also health equity. I'm also a member of the Governor's Racial Justice Council for the last 5 years, when Governor Brown started that council, and currently continue with Governor Kotek. I co-chair the Health Equity Human Services Committee on that council, and also part of the Economic Opportunity Committee. I'm also a Business Oregon Commissioner with Business Oregon over a year now, and also co-chair of the Oregon Health Industry Consortium. Was created by the Future Ready Oregon through the HIMAC about 2 or 3 years ago. Been in Oregon 22 years. I have 4 kids. One lives in New York, one in London, two here in Salem, Oregon. I really love the community, and I look forward to working with all of you, and it's a pleasure. I'm really looking forward to engaging and learning, of course, and conversing, and really important issues, especially now during this climate, and looking forward to meeting you all. Thank you.
Thanks very much for being here. Welcome. All right. So then we'll circle back when TK is able to join. Sean, I'm trying to find you on the screen. Are you on?
Yes, I am. Can you hear me?
Good morning. Please take it away.
Thanks for having me. My name's Sean McAnulty. I'm OHP Member Communications Coordinator. I'm here to share some updates about OHP Bridge. We've talked about this issue before, or I guess the issue we'll be talking about today before, but wanted to provide some updates to that. For folks who aren't familiar, though, OHP Bridge is a new benefit we launched in 2024 for some adults with higher incomes, specifically folks between 133 and 200% of the poverty level annually, between ages 19 and 64, who don't have access to other health insurance using the same standards the marketplace uses to define that, and who have eligible citizenship or immigration status, again, using the marketplace rules for that. OHP Bridge is the same benefits as OHP Plus, except for health-related social needs, the new climate waiver and housing benefits we launched last year, and long-term services and supports, which are like in-home care tasks, or like personal care workers to support with daily personal care tasks and things like that. So basically, same benefits otherwise. We can go to the next slide, though. We had an update that happened I guess the first part of the update was back in July, where we blocked new enrollments for people who have DACA status for OHP Bridge, when the administration announced the new marketplace affordability rule and integrity rule, which changed the definitions for who counts as a qualifying immigration status for these programs. Back in November of last year, the previous administration had made this people DACA status eligible for these benefits, and that was reversed. So new enrollments were blocked back in July, and then about 50 people with OHP Bridge lost coverage on the 30th of September, about 2 weeks ago. Unless there's any questions about that change, we'll move on into the main one we're here to talk about today, which is the coverage gap we had spoken about previously. So there was a issue identified where people who had moved from the marketplace over to open enrollment, specifically during last open enrollment season, not outside of open enrollment season, may have experienced a gap in coverage while waiting for OHP Bridge to start. Part of the context here is some guidance we got from the federal government that the marketplace may not allow people to re-enroll in the new plan year. Basically, once they had been referred to OHP or OHP Bridge, the marketplace might not let them select a plan for the new calendar year. They have reversed that guidance for 2026. It probably wasn't the case in the system and was actually being permitted in some instances, but in some cases, we expected this to be happening in 2025, which could stack up with the OHP Bridge rules for application processing time, which for any OHP or OHP Bridge application, we have up to 45 days to review that application and make a decision. And then OHP Bridge's start date rules take effect, assigning benefits 2 to 6 weeks out in the future. Between all of those things, it could produce a several month gap in coverage for members, where we're going to be offering them the option to move their start date back to the beginning of the year, letting them rebill any services during that time when they were insured and get those paid by OHP Bridge still. So we've got about 1,500 members who are potentially eligible for this, who are going to get or received a notice earlier this week that they have this option to move the start date. If we can go to the next slide, we've got a little reference here on those start date rules I referenced. Basically, once the application is processed rather than submitted, unlike it's kind of similar to the marketplace dates in the broadest terms, but OHP Bridge, instead of using the date that the application is submitted, will go off the date that it's processed. So once we clear that 45-day processing time, or it's usually faster than that, I believe our average is somewhere closer to a week currently, and many people get determinations immediately from the system as well. But once the application is processed, we would assign the date either as the first of the next month or the first of the following month, depending on when it's processed within the month. So if we processed an application up until yesterday in October, that would produce a November 1st start date. If we instead process it today, since we're in the second half of the month, that's going to produce a December 1st start date instead. So depending on when in the month you get processed, it's 2 to 6 weeks before the OHP Bridge starts. Our next slide is a graphic about how this coverage gap occurred in 2025. So starting from the bottom left, if someone had updated their application back in at the beginning of last December, that would start the 45-day review period for us to give them an answer, which is marked in the orange box at the bottom there. That would put them past the date when healthcare.gov was telling us that members may not be able to lose a plan or not be able to reselect a plan for the new calendar year. And that 45-day application review period can run until the second half of January. If we processed an application in the second half of January, that would produce a March 1st start date. So in this example, the person ends up with a 2-month gap in coverage before their OHP Bridge begins, which we've got marked in the purple area. That is the time where they'd be eligible for the start date adjustment, where we'd move their OHP Bridge start date from the March 1st date that the system gave them back to the first of the year, letting them rebill any services they received in that time. So there would be some limitations on that. For instance, if the provider is entirely out of network with OHP and does not work with OHP at all, we couldn't rebill that. Same goes for pharmacy bills, which are billed at the point of sale. So that makes it quite unlikely to be able to rebill those as well. If we can go to the next slide, though, the process for members on this is going to be, well, I guess we just sent the notice of 1,500 members, specifically those who were referred to us by the marketplace is where we get that list of 1,500. We don't know for sure that they were actually enrolled in the marketplace versus just referred over by the system, as in they were newly applying for the marketplace and got referred over for a decision from us. So we can't quite distinguish between those two factors. We also don't know who had a gap in coverage before their OHP Bridge started. So we're sending it to the realm of potentially eligible members who were referred by the marketplace system and then ended up with an OHP Bridge start date of February, March, or April 1st. If they attest to us that they had that gap in coverage and were on the marketplace previously, which they do by providing a voicemail, then we'll move that start date back to the first of the year. That way they can get those bills rebilled. So the notice asks them to leave a voicemail. The next slide will get a little bit more into the process of what happens on the back end there. So once they contact the number on screen, all they need to do is leave a voicemail with the name and date of birth of the OHP Bridge member who needs the start date adjustment. That response to the voicemail confirms that they want us to take the action. We're not going to be automatically extending it for the entire population since we don't have that information on who actually had the gap in coverage. And many of these people would have avoided care while uninsured due to cost sensitivity or something. So in many cases, services weren't provided. So we don't want to blanketly pay the CCOs for care for the whole population that wasn't actually delivered in most cases. So it's available by request. And then once that comes in, the voicemail comes through to me. We route it over to the eligibility team, who will then move the eligibility start date within the one system. Once that has happened, it goes over to the CCO services team, who backdates the enrollment in the CCO back to the first of the year, which is a little bit outside of our normal processes. That way the bills can be paid for those service dates. Once both of those steps happen, which takes about a week, potentially two, the OHP client services unit is going to call the member back, confirming that the process is complete and helping them or either call providers or just explain the process of how to rebill with their providers. So once the steps to move all of these start dates are complete, we need to contact each of the providers that they had received service from during their time uninsured, tell them to resubmit the bill and give them the OHP ID number, and that gets the bill to the CCO, at which point, once they've completed the payment process, which typically takes a month or so, the provider would be able to reimburse the member for anything that the member had paid that provider at the time, once the provider gets paid through OHP instead. So that's kind of the rough process happening there. We're really hoping to get a live caller response system set up, but unfortunately this has been quite difficult to implement, and is the best solution we're able to come up with given the time, resources, and number of people involved in this effort here. So next slide has a little bit more about the 2026 understanding of and change in guidance here. So last year, the federal government provided guidance that the marketplace would likely be cutting off coverage and not letting them re-enroll in the new plan year. However, this year the government has changed that. The federal government has changed that advice, and people should actually be able to maintain their enrollment in their marketplace plan across the start of the calendar year until their OHP bridge starts the same way that they can outside of open enrollment season. So this means those two timeframes are basically consistent. If you're enrolled in a marketplace plan, then get that message saying your application has been referred to the state Medicaid agency for a final decision. You can maintain enrollment in your current plan or across the start of the calendar year, the most similar one that it auto re-enrolls you into, until your OHP bridge starts. So the new instruction is once your OHP bridge starts, or your OHP, depending on which program you get it approved for, provide that start date to the marketplace. Reporting that change via the system will line up the end date of the marketplace coverage with the start date of your OHP bridge benefits. So following the same process as we instruct members and partners like assisters and brokers to follow, we want people using the same system in and outside of open enrollment season, maintain coverage in your current plan until you get that outcome from us. So with that, that means the gap is not necessarily going to exist like we understood it was going to for 2025. So we won't be offering the special request process in 2020 or for calendar year 2026. This will be a one-time availability for the launch that we're not going to be offering that special request part. It is an avoidable gap in coverage going forward. So we have this process available for this year to rectify the gaps in coverage that happened earlier this year. Members are going to need to get that request into us by November 30th, and then they need to complete the billing process with their providers with help from client services by the 1 year mark from whenever they received the service last year, which is the timely billing requirement. So this whole coverage gap start date adjustment process is the main thing we had to share this month. If there's anything else, questions about OHP Bridge or about this process that I can answer, I'm happy to take questions.
Looking to see, I'm not seeing any raised hands. Give it another second here. Okay, I don't see anything in the participant list, but thank you.
Thanks for having me. Until next time.
Take care. Okay, I think we're moving on to the marketplace update. If the team could take it away, please.
Hello. Hello, my name is Dorisita Mardership. I am the project manager for the state-based marketplace. And today we're going to cover a few topics here. We have some of our standard ones, which is the overall project timeline. We're going to cover some of our project accomplishments, go over the implementation timeline. We have Get Insured invited, our solution vendor that will be putting our solution together is invited, and we'll do some introductions and cover some topics. We have our 360 90-day forward view, and then all upcoming partner engagements. Next slide. Right, so this slide should look familiar to a lot of folks. This is just our standard timeline, high-level timeline showing what we have when we started the project back from July 6th of 2023. And everything in light blue is we have completed. So we've completed the procurement for the solution vendor. Our contract negotiations have been completed. We have started our implementation activities with them. And our implementation activity started in August and will go through our full launch of Go Live is planned through November 1st of 2026. And then we'll move into operations. And then within that same timeline, as we're going through O&M, we do have some closing activities that we need to close up the project by doing some lessons learned and closing out some, doing a closeout report and lessons learned activities and officially closing the project out. And we plan to get that completed by March 2027. Next slide, please. And then here is just a few accomplishments since the last time we have shared updates with you since July. Within July, on August 1st, we have completed a cloud workbook. This is the internal security document where we would be ensuring that we are taking the appropriate steps to mitigate risks from a security standpoint. We've completed that and got the appropriate approvals from our security offices. We also obtained the Stage Gate 3 endorsement. This is where within our DAS ES folks, this has a lot of oversight on the project. So we got our Stage Gate endorsement to move forward with executing the contract and then starting our implementation work. On August 6th, we actually executed the contract with the solution vendor, which is Get Insured. And then we worked with our vendor, Get Insured, to do a kickoff. So our first bigger kickoff was August 27th, and then we actually had a 2-day one, so another partial kickoff on the following day. We also conducted partner listening sessions. We continue to do that with our carriers. Conducted an introduction session with our partner carriers. So this is where Get Insured was invited, and they have did some introductions and provided an overview of the activities that they would be involved in supporting the implementation activities, and that took place on September 24th. And then recently we just got together with our executive steering committee and provided them an overview of the updated project budget and schedule, and we have got their approval to move forward with rebaselining the schedule and budget for the project. Next slide. Then I'm going to go ahead and transition this over to Victor. He's going to go ahead and give you a more detailed timeline about the implementation activities.
Morning, everyone. Victor Garcia. I'm Operations Advisor and Program Liaison for the Marketplace and Business Lead for our SBM project, and really excited to show what we've been showing you, especially this. I know the text may be a little small for slide format, but hopefully it comes across a little easier on virtual. But this is our more detailed timeline implementation schedule after executing the contract with Get Insured, which I believe happened since the last time we talked to you. So that's been a lot of activity since that time. So here we have kind of now through March 2027, which is the end of the project period, as Dorcita was just describing. And then these are the individual steps, which of course have lots of stuff underneath each one. So through end of January, we'll be continuing to talk with Get Insured about our requirements, getting those completed in terms of our the things that we have that are specific to Oregon that are different from the sort of base platform that Get Insured provides. Anybody looking at this, it is like, it represents a year and change, which to do something like this feels really fast. But just as a reminder, we're most of the way there with what we need with the Get Insured base platform. So what we're doing here is really kind of configuring it to Oregon specifics, our branding or that sort of thing. So once we finish that part in February, we'll kind of concurrently start seeing the first of our environments that are for us on that platform, and then finalizing the configuration and customization as we go. And then as we move on down the line, we've got some key milestones there, including the red dots. So our connection to the Federal Services Hub, that's an important kind of clearance step, getting permission from the feds to be able to connect our system to that hub for eligibility checks. CMS operational readiness reviews that happens in the summer, and that's where they make sure that at least from a federal standpoint, we're compliant, and that that's sort of the green light, go, no go, is everything look, can it be demonstrated to work in the way it's supposed to work in November, so that we get that green light. And then completing QHP certification, which is where all the plans get certified, and we ensure that the carriers are all connected properly, and they can verify that their information has been uploaded correctly and that what we have is correct. And so with all that going that way, we plan to soft launch in October. October 1st is the kind of roundabout date. It really depends a lot on CMS and when they complete certain steps that will allow us to do that. So once we are sure that we can do that, or if it comes before then, we plan on soft launching on 10/1, so that's everybody is able to get in, have a preview, have a look. Can't really do any applications yet because we have to wait for the start of open enrollment, which is the next star at 11/1. So lots of stuff going on in between. It'll be a very busy year, and I look forward to giving you some updates on our progress as we go. Are there any questions about this schedule? I know this is kind of a lot of lines, and there are, again, lots of underlying pieces for each one, but happy to answer any questions at this stage. Okay. And always happy to share more if you do. So get back to us if you think of anything later. Next page, please.
Looks like someone has their hand up.
Oh, yes.
Yeah, hi, Victor. Moran. I had a quick question. How's the federal climate impacting this work in terms of plans? What's that bringing to your workspace in dealing with all this?
That's a multi-layered question. Thank you, though, an important one, because it's definitely informed everything that we've done to this point. I would say even talking to get insured and getting through that, the negotiations process of the contract was first time I've participated in something at that level, but I could tell even then what you're talking about actually had an impact on how long that took to talk about, because we had to consider things that and talk through how we would deal with them that we wouldn't have even had to think about in 2023, for example. So so that I really feeling that how that even informed that and kind of stretched out those timelines was strange. And what we know is that we can't possibly predict what might come in 2026, but we do know that the processes that you see here, the timelines that you see here, are also kind of including the possibility that there may be a pivot. We don't know how hard the pivot would have to be, but if there's something that comes up during the course of that year, we would definitely have to incorporate that into how we're putting this together and talk through, if changes come after we get through those requirements portions, here's what we need, and into the part where we're actually starting to put things in place, and then something changes. How do we react? How do we, make that happen in time for the deadline? That's concurrent with our partners in the One System and the OHP side of things, and BHP, which all would have to similarly react to any changes to those programs, and we'd have to be aware of those as well. So it's, again, a multi-layered question. I guess in the present, to your question, like how is it impacting what we're doing right now? For the marketplace, there aren't any huge implications that we have to worry about right now for the things that are known right now. It's the sort of unknowns that may come in the coming year that we're a little more worried about. Right now, we can still account for those things and talk through them and have solutions ready from Get Insured. But yeah, so that's to say this schedule accounts for what we know now. And then in terms of whatever may come, there's definitely the freedom for us to come up with solutions and have a partner that's serving many other states that has a vested interest in like already knowing our business and already having to come up with solutions to any problems that may come up that impact other states too. works in our favor, and we'd have a little more agency to be able to deal with that in the way that would be best for Oregon, instead of having to rely on a federal system, which is sort of a one size fits all. So it feels like the timing couldn't be worse in some ways, but really from that perspective, we would already be seeing the benefits of having the agency to do things the way we would want to do them during implementation before we even launch. So that's the optimistic viewpoint that I'm choosing to take. Anything that's so serious that it would put this schedule in jeopardy would put a lot of other people and things in jeopardy that isn't just our SBM project, and we're keeping that front of mind as well. So we're as prepared as we can be to deal with any really, really weird changes if they come.
Thank you, Victor. I know it's a very complex question, but thank you for your work. Thank you.
Hey, thank you. And so we've got upcoming partner engagements. We've shared these slides before. I'll just move through this kind of quickly. We have our project newsletter that we do quarterly, partner listening sessions, which now that we have an executed contract and we have some firm schedule items and other ways in which our partners will be participating during the implementation process, we'll have more to both share and hopefully listen to in terms of feedback during these partner listening sessions. Those are with our insurance agents, our carriers, and our community organization assisters. Those are quarterly, so we'll have those in October, January, and April. And again, those are a very important part of our feedback loop of those very important external partners. We've got quarterly updates to the legislature, and those are kind of something we need to do, but also something we are proud to be able to share our progress on. So looking forward to those in also October, December, and January. Industry communication with insurance carriers. We do that jointly with our friends at DFR. We may need to update this schedule, but because I think this cadence has changed, but we do those regularly and make sure that our carriers are staying informed of what we're doing in that space as well. And then updates in our monthly for our agent and community partners, and our general sort of newsletter that's more broadly focused on all the things we're doing. Those are also monthly. And then our tribal outreach engagement, as we are able to identify places for us to participate, and also as we are asked. So those dates are kind of random in a way, but we try to hook in wherever we can, or wherever we're asked to. So those are November, December, February, and March. Any questions on any of those? Okay, and I think with the next slide, I'll hand it over to Get Insured.
Awesome. Thanks, Victor. And thanks everyone for having us. My name is Claire Houderman, and I serve as Get Insured's project manager for the Oregon SBM implementation. And thank you so much. I'm joined today by Heather Korbulik, who serves as the policy lead for specifically the Oregon implementation, but is the VP of Policy and Communications for Get Insured. Just to give you a little bit of a roadmap of what we'll cover today, we'll do a quick introduction so you all get to know us a little bit more. We'll get into how Get Insured is structured and how that helps us to serve states across the nation on past SBM implementations and how it will help us serve Oregon. We'll talk a little bit about the product itself, and then we'll layer on what Victor and Dorosita have already started, just to give you a little bit more insight into what you can anticipate in the next couple of months from us on this project, and then wrap up with a policy component that Heather will discuss, and we can certainly get into that last question a little bit more too at that time. So just to start us off, like I said, my name is Claire Houderman, and I'll be the project manager from the Get Insured side. Prior to Get Insured, I was supporting CMS as a contractor, helping with all things related to the ACA marketplace operations. I started more on the insurance carrier side, helping to make sure our carriers were certified to offer plans on the exchange, and then moved more into the eligibility and enrollment landscape to help the marketplace prepare for the restart of redetermination efforts after the Medicaid unwinding period. So excited to bring all of that expertise and that passion for improving access to coverage to the state side, with Oregon in particular. But I can go ahead and pass over to Heather quickly for an intro, and we can keep going.
Great, thanks, Claire. Hi, everybody. My name is Heather Korbulik, and I am the Vice President of Policy and Communications with Get Insured. And before joining Get Insured, I ran Nevada's health insurance exchange for about 7 years. And we were the first state to do the project that Oregon is about to successfully manage over the next year. So very happy to see all sorts of states following behind. I also spent a year-ish working as the interim CEO of the New Mexico Exchange. And have spent quite a bit of time in policy and health policy working for the state of Nevada and all of our other state clients now. So I've watched, I think, 5 states go live since Nevada did, and you're in very good hands, and we're really looking forward to working with Oregon. I am a duck. I am from Oregon, and so this is kind of a near and dear project to my heart. So thanks for having us.
Awesome. Thanks, Heather. And then one other intro that I'll do is, of course, Jason Sparks. He was unable to join us today, but Jason will serve as our implementation director for Oregon and is the VP of project management and implementation at Get Insured. Jason is incredible. He oversees the implementation of all of our SBM transitions across the Get Insured portfolio. And prior to Get Insured, Jason also had marketplace experience serving as the CIO for the DC Marketplace Exchange, in addition to just being an incredibly experienced technology lead with a great track record of successfully leading complex technology implementations and completing the necessary maintenance and operations projects to keep all of those projects running. So we're so grateful to be here. That's a little taste of our implementation leads. And then I think we can get to the next slide, and I can show you a little bit more about the Get Insured structure. So Heather, Jason, and I are part of the implementation team right in the middle. And this team is composed of other folks that have senior roles from past SBMs, other state agencies like Medicaid and SNAP, insurance carriers, and then other technology firms. We have the amazing privilege of being the face of the implementation, but we're really just the tip of the iceberg. We have a large team of over 700 specialized personnel who manage everything from other types of client relationships, product operations, managing reoccurring processes throughout the implementation, and then, of course, in the maintenance and operation phases, the policy components, and then always looking for ongoing improvements to make sure that we're providing our clients and, of course, Oregon with the best products possible. Our team, the implementation team, also has the privilege of being able to interact with those executive sponsors at the state. And we're just so grateful to be able to work with such an amazing group of execs at the marketplace level. Chicky, of course, in particular, and then the rest of the executive steering committee. Y'all are such dedicated and bright folks, and we're so excited to help improve the healthcare access for Oregonians throughout this process. And I think we can head to the next slide. Great. So on this slide, we start to get into at a really high level our solution and what we're looking to provide for Oregon. In a nutshell, this is not our first rodeo. For over 10 years, Get Insured has supported over half a dozen states with SBM transitions, which has allowed us to create and really mature a comprehensive solution that meets all ACA requirements, plus that integrated contact center right out of the box. This has allowed us over the years to create the best systems and processes and then pair them with the best possible folks for the job to make sure that we're really tailoring our product to the needs expressed by each state. During the initial design phase, we'll make sure that the Oregon SBM project is compliant with all federal and state rules. We'll use federal and industry standards to also minimize the impact on the one system, insurance carriers, and other partners, just to make sure that what we are introducing for Oregon on the marketplace side doesn't disrupt the rest of the wonderful healthcare work that is happening across the state. We've also developed a robust playbook for all of the processes that we'll take on during the design phase, as well as the maintenance and operation phases. And this playbook is updated with the successes and the things that we've learned from past implementations to make sure we're always giving our states, and especially Oregon, the freshest and most helpful solution to meet their needs. I think what really sets us apart is beyond just our technical prowess, we take the time to get to know Oregon. Beyond just Heather being a duck and teaching us how to Oregon in the best way possible, we've spent time to really understand what you're looking to prioritize and make sure that that's part of the solution and that it's front and center. So we'll continue to work with you all to make sure we're aligned on requirements and timeline, based also on what that federal landscape looks like to make sure that we have a successful go live. Once that go live happens, we'll then move into the maintenance and operation phases. And this again is a refined process at this point. During this phase, our job is to make sure that we continue to offer that great solution that we developed during the design phase, but that we're working with our states still to identify and suggest any functional improvements and upgrades to the technology to make sure that our systems are evolving with changing regulatory needs at both the state and federal level and any ongoing technological advancements. Next slide. On this slide, you can see all of our work across the nation, and we have Oregon highlighted in yellow since we're so excited to be able to dig in there. These are the states that Get Insured has supported throughout the years, and a little bit of additional information on the specific type of solution that we've provided each of these states. All of these states have had unique goals, and we've worked with those states to make sure that our out-of-the-box solution still meets what they're looking for and can really be customized to support their consumers. So we're excited to leverage what we've learned in the past to really bring the best product to Oregon ahead of the plan year 2027 launch. And next slide. Awesome. So just building a little bit more off of the focus for Oregon's priorities. So in talking with you all, we know that it is critical that we continue to prioritize the consumer journey. This is the big focus of Oregon, not only for the marketplace, but for the Bridge program as well as for Medicaid. And we want to seamlessly integrate into that mentality. So what does this mean? It means making sure in particular that whatever application flow we build is intuitive to the users. We'll spend some good chunk of time with you all in November, really talking through what this consumer flow looks like and start to understand what your preferences are in terms of configurations beyond even the requirements for making sure we have an accessible and accurate application flow, and really make sure that this meets what you all think is best for our Oregon consumers. We'll also continue to work with you on making sure that we can connect with Oregonians in a variety of languages. We know that there's a lot of languages of interest and need based on state requirements, and so working with you all to assess how best we can meet those needs is certainly a priority for us too. Additionally, we know certainly with the changing policy landscape, it is important to focus on bridging coverage gaps. Oregon has the Bridge program, which is so exciting. And so making sure that we work with the OHP team to really understand how we can embed into existing processes seamlessly and without a ton of strain on their end is what we'll also plan to prioritize. The last couple of moments, I think we've hit on, but just to summarize, we've spent a lot of time researching Oregon and really making sure that we've connected with you all to understand what you're hoping to get out of this implementation beyond just establishing the SBM. What heart do you want to bring to it, and what do the focuses need to be in that implementation? We're excited that we're able to pair with you all now as industry leads in transitions to make sure we make those dreams a reality. Next slide. Great. Okay. So what does all of that mean? This slide starts to showcase what's coming up over the next 3-ish months. And I know Victor did a great job of showcasing at a high level what our next year with you all looks like. But breaking it down a little bit more, in the next month, we'll start to spend a lot of time with Oregon folks on assessing the specific requirements that they have for their implementation and how the Get Insured solution meets those requirements. So that is done through a series of product orientation sessions to really make sure that we're aligning our product with your contract needs. What we'll also be doing at this time is starting to integrate a little bit more with our carriers. So providing them resources, including an 834 companion guide, to be able to start to think about what changes they may need to make to their systems, and also just start to get a little bit more face time with them to better understand what their concerns might be so that we can continue to think about those down the line. We'll also hopefully be kicking off discussions at the federal level too to make sure any of our operations and our plans are in line with what CMS has outlined and begin to have those regular conversations with them. In December, we'll start on more of the consumer-facing components. So this includes discussing the notice content and the UI content to make sure that we're in line with what Oregon is looking for both of these components, and then working to incorporate those changes, any specific language or feel throughout when we're creating those notices and creating those environments. What we're also doing, and this hits a little bit of the policy component question, is starting to assess the gap analysis between our solution and the healthcare.gov interface. Since we have done this before, there's not many gaps, but we will continue to still do that gap analysis and showcase to Oregon where we may need to make some changes or provide additional insight to CMS in terms of how we'll meet those specific requirements and fill those gaps between the UI we're planning to provide to Oregon and what CMS is looking for or has right now. And then 90 days out, this is where we'll start to wrap up our requirement discussions during those product orientation sessions. We'll continue to fill out the specific tracker, essentially, that we will maintain to showcase how we will meet each of those requirements, and then also start to discuss with OHIM the specific configurations that they're looking for the various requirements. Next slide. Awesome. I can go ahead then. That was, I know, a lot about Get Insured, a lot about what we're looking for in the next couple of months. We have a couple other slides just to touch on policy components, and then can certainly open it up. But I'll pass off to Heather for right now.
All right, thanks again, Claire. So I will just start by saying that I have been in the ACA world managing and monitoring policy for over a decade. And this has been the most exciting, and I will put that in quotations, exciting year for policy. And that says a lot. So I, the talk of the town of every town right now is about enhanced premium tax credits. I did not think we would ever get to a place where an entire government shutdown would be focused on something this policy wonkish, but very excited that it is getting as much attention as it is. And I guess I will give you kind of an insight on how our team works. So primarily, we are, what my team and I do is we monitor all of the policy landscape. We think about what does this mean for our clients, both technologically and operationally? What system changes will result from the policy change? And how do we need to help and advise, or at least provide information, insight to our clients in terms of how to operationalize it. Sometimes that relates to the call center, and other times it's related to just sort of like, what might you consider? Maybe you want to send out a special notice to clients, and this is how you could do that. So right now, all eyes again are on enhanced premium tax credits, and obviously this change, if it happens in the next few months, won't impact Oregon on our platform. So I'll speak to it and how we're communicating with our clients about this. I'm sure all of you know that if these do expire at the end of the year, as they're set to, all of those households over 400% of FPL are going to completely lose financial assistance, which is where we're seeing a lot of articles right now with the giant sticker shock. But I think what gets a little bit less attention is the fact that those enhanced premium tax credits are also applicable to people who are in that standard 138 to 400% of the federal poverty level. Those people have been getting more generous subsidies thanks to the enhanced premium tax credits, and they will see increases in pricing and reductions in assistance as a result of that expiration. The Kaiser Family Foundation estimates that the net gross premium increase across the board is a 75% increase. I will tell you that another one of our clients just told their board today that they're seeing 110% increases in pricing. So it is variable, it is significant, and it is effective January 1st of 2026. So whether or not Congress decides to make an extension, we're kind of in a place now, October 16th, where the first state on the Get Insured platform actually opened enrollment yesterday. So Idaho is our first to start open enrollment. They start on October 15th. So they've already run their renewals, and their rates are displaying without the enhanced premium tax credit. So the people of Idaho are getting notices that show the rates for plan year 26 without the enhanced premium tax credits. Some of our other clients are right now, like today, running their renewals, and we'll be sending out those notices in the next week or so. And most of our clients have as Victor had mentioned earlier, we have this window shopping opportunity open right now. So everybody can come, brokers, consumers can come online and take a look at what the plan rates will be for 2026. And of course, because we don't have any certainty about the extension, those are showing as being without enhanced premium tax credits. Now, all of that's just not to say that we cannot pivot. We are completely capable of pivoting very quickly, and we have a menu of different scenarios that we plan for. So a lot of this will come down to timing. If Congress does take action before November 1st, which, to be frank, is not looking very likely right now, then we are able to go back and run our renewals and reset the rates and move pretty quickly where that's concerned. It's an enormous amount of work. It's not the best case scenario, but it is something that's achievable. If they decide to extend after open enrollment, then that's a more complicated job, but we can, of course, go back, rerun our renewals, apply the enhanced subsidies, And that's where it gets really confusing for consumers because they've been told one rate and then now they're getting another. And I think what most state-based exchange directors have really eloquently communicated is that implication or that impact is going to result in people losing coverage and not coming back to the marketplace. So unfortunately, we are sort of entering the worst case scenarios of Congress not taking action. I mean, ultimately, the worst case is that they don't take any action at all. So the other kind of what ifs that we're monitoring in this space is the chatter that we hear from DC around whether Congress will maybe change the formula on these enhanced premium tax credits and how will we manage that? And in absence of any clarity about what that would look like, we can just plan for the best or plan for the worst and maybe expect the best. But ultimately, that does complicate things a lot if they were to make a change in how that gets formulated and who gets access to those. It would be a pretty significant change that we'll all have to run quickly around. And then, there is the potential, we've seen it during the COVID time when plans or when Congress took action outside of an open enrollment period, even into the next plan year. So we are prepared for the case where potentially in January or February, they decide to add those enhanced premium tax credits back. We would go back, renew everyone with that new rate and backdate the time is as permissible by the feds. I'll pause, see if there's any questions on what we're thinking there, and happy to move to the next slide. Yes, go ahead.
Hi, Heather. Quick question. Can you explain to me what is the rationale behind expiring the tax credits that you understand or I'm just trying to understand the rationale behind that and the logic behind that, I guess. If you know that, if you don't, that's fine, but just I'm trying to understand.
Sure. I will do it without my cynicism, so I apologize in advance. I will give you just the facts. So the rationale is that the enhanced premium tax credits were implemented during the American Rescue Plan Act during COVID. And they were really primarily, to get more people coverage during a worldwide pandemic. And make coverage more generous or not make coverage more affordable for more people. They always had a set expiration date of the end of this year. And I believe that Congress feels like, COVID is over, that these subsidies have always been set to expire and that there is no need to continue with this level of benefit. I think that the opposite party is arguing that this has really done a lot for making sure there's so many more people covered with generous benefits and with the ability to afford it, and that we should extend it. That argument is above my pay grade and is currently playing out in DC, and whether they'll get to a resolution, I don't know.
Thank you.
Mm-hmm. I can't see any other hands, so if I'm missing anyone, sorry, and please chime in. Otherwise, we can just go to the next slide. Thank you. I promise not to bore you all with all the details of this. I think what I really wanted to show here is, like I said at the top, this has been really a complex year in terms of health policy. Not just, Medicaid gets a lot of attention, rightfully so, but the marketplaces have had a very dynamic year. And what I'm showing you in this beautiful Venn diagram here is that we had a very significant change in rules through a marketplace integrity and affordability rule. Then we also had the HR1, otherwise known as the One Big Beautiful Bill Act. And so there is an overlap between the two of them. And then, of course, at the last second, we've also had a court injunction. Several Democratic AGs have filed a lawsuit and have put a pause on many of the provisions in the marketplace integrity rule. I won't bore you with all of the details of this. And Chicky, if you want me to talk about any of them, please let me know. But what I will tell you is that We've been incredibly nimble. The way that we build our policy solutions or the way that we build our platform is in a very configurable way. Think about it as on and off light switches. So if they want us to check the IRS for whether or not someone has failed to reconcile their taxes, we can turn that button on. If they don't want us to, which has been the whiplash we've had this year, we can turn that button off. So it's relatively pretty easy because of the way that we've built this platform. Chicky, is there anything you wanted me else to talk about specifically on this? I don't want to use too much of your group's time.
Thanks for asking, Heather. HIMAC team, the marketplace team will have a section about federal policy here in a little bit.
Oh, great.
So thank you for offering, Heather, but we do have a separate topic regarding the federal policy and impacts to the marketplace. So thank you for thank you for letting us know it's an on-off switch. That definitely creates a lot of comfort, especially in the Oregon side.
Yeah. Yeah. And then I just have one more quick slide, and I just kind of wanted to show you all just how we think of, in a normal year, we know what to expect in terms of policy documents that are going to impact our exchanges. Every year we get a different notice of benefit and payment parameters. It establishes new rules or new methods, or very often these are optional for state-based exchanges. We have seen under this administration less flexibility or less autonomy given to states, but there's still a lot of opportunity to navigate policies in the least impactful ways where and when appropriate. So we'll be looking for that this next year. We do know that the HR1 requires some limitations on different immigrant groups who will qualify for tax credits. And then looking ahead to 2028, we'll be engaging Chicky and her policy team very soon, actually, in a conversation that we're having about how to build a solution around I'm putting it loosely, the restriction on automatic re-enrollment. And this is a very big deal. I'm sure you'll talk more about it later, but we want to kind of get crafty with our states and figure out how to do this in a way that makes it as easy as possible for consumers. And then I'll just say finally, we're very well aware and connected with Medicaid agencies across the country and pay a lot of attention to what Medicaid policy will do for our marketplaces. And big spotlight right now on the community engagement, AKA work requirements, and how those are going to impact the exchanges in terms of churn and how to manage that and how to really kind of save people from the gap. And then, Medicaid has a new requirement about redetermining every 6 months. So that will, of course, impact exchanges, and there will be a lot of opportunity to capture people who fall off in that way too. So looking forward to long and substantive policy conversations with our friends in Oregon. And like I said, I'm very excited to be working with you all and happy to take any questions.
I'm looking in the participant bar. Anyone have a question? You want to raise your hand? Okay, I am not seeing anything, but thank you very much. Obviously more to come. I know we're going to transition to public comment. I was remiss earlier and neglected to acknowledge Bill Kramer, our Health Policy Board connection. So apologies, Bill. Thanks for being here. That's my bad. I think, Chicky, we can transition to public comment unless I've missed something in the back and forth. We good?
We can transition to public comment. And Dawn, did we receive any requests for public comments for email?
No, we did not.
Okay. Giving it a minute in case there's someone who didn't get a request in but wants to make a comment. Okay. Then I think we can transition to 2026 rates and updates. And we're close to on time. So thank you, everyone. Is the team, sorry, I didn't even look if everyone, yep, okay, there you are. Hi.
Tasha, you are on mute.
Sorry, that's what the issue is. I didn't see you. Please go ahead. Sorry. And you're still on mute. I think you might be double muted. Nope, try now.
Can you hear me now?
Yes. Yep.
Oh my goodness. Yay. Hello, everybody. Thank you for having me here to chat with you today. My name is Tasha Sizemore, and I am the Life and Health Product Regulation Manager at the Division of Financial Regulation. Katie, are you on? Are we doing this together? You want to introduce yourself?
Sorry, I'm also double muted. Zoom really does not want us to chat today. I'm Katie Button. I use she, her pronouns. I'm the Plan Management and Policy Analyst for the Marketplace. And I'm happy to be here with my good friend Tasha from the Division of Financial Regulation. Go ahead, Tasha.
Yeah. So today I'm here to do my annual chat about rate and product filings for the individual market for the upcoming plan year. I'm going to mostly focus on the individual market and skip over most of the small group market. But if you all have questions, please feel free to ask. As you've heard at several points during this meeting, since I joined the call even, consumers are going to experience higher rates this year. And although I'll chat a little bit about what we saw in the rate filings, the biggest consumer impact will likely be the result of the loss of expanded APTC, which, as you just heard, sunsets at the end of this year without action from Congress. Before I get into what the rates were, I would like to discuss a little bit about the rate review timeline that's on the screen. It, as was just explained a little bit by our friends at Get Insured, this year has been a challenge and complicated, and a great year for the division to work together with our friends at OHIM and our stakeholders at each insurer to get this off the ground for the year. So what you see on the screen is what the rate review timeline looks like for us. As you can see, the rates, I think most important is to know that the insurers start developing the rates before that January 13th date. So insurers already sort of knew what they wanted to file with us when the Biden administration finalized the notice of benefit and payment parameters in January of 2025. In mid-February, the new Trump administration announced planned rulemaking and other new guidance that put all of us on notice and was really the first indicator that this year would not be what we experienced in the last couple of years. The draft program integrity rule was released in March, and we did have some insurers make adjustments to their plan designs based on information found in the draft program integrity rule. Carriers also had to get the actuarial value calculator because of changes that were discussed in the program integrity rule. So it was really important for the insurers to get the draft AV calculator and rerun all of their plans through it. So all of that had to happen before the May 14th deadline to submit filings in Oregon. And CMS hadn't even really finalized the program integrity rule, so our insurers were still using, at least for the AV calculator, something that wasn't entirely finalized. By July 1st, we had court cases challenging the program integrity rule, making 3 insurers in Oregon have plans that were no longer valid. Consistent with the requirements of every year, we transferred the rate data to CMS, Katie and I did, so that plans could appear on healthcare.gov for open enrollment. we issued our final orders and thought that everything was done. And Katie and I did a little bit of a dance on Teams because it was really nice. And then a stay was put in place for several of the provisions that were challenged by the city of Columbus. And one of those provisions, the one that impacted us, related to the actuarial value calculator. So by the end of August, Katie, myself, and insurers were getting sometimes mixed signals, sometimes conflicting information about what to do. Finally, a correction window got issued, and we had to have 3 insurers make changes to their plans because of this. And I'm going to talk a little bit about 2 of them that matter to us. So can I have the next slide? Yay. So we didn't put it on this next slide. So I'll let Katie do that in just a second. So the 2 insurers in Oregon that had an impact were Pacific Source and Regions. So they had to make plan changes, and Katie will talk a little bit about those changes for Pacific Source specifically in just a moment. So those were some pretty significant delays and changes to our rate review process. For Pacific Source specifically, because of the changes in the AV calculator and the stay, we actually, Pacific Source actually made some changes to their rates. We reviewed those rates and then issued final orders to accommodate that under Oregon law because of the AV calculator change. So at least as it relates to the City of Columbus lawsuits, there were some changes there because of that kind of timeline crunch that we just discussed. Before I talk about other impacts to the rate changes or to the rates for 2026, does anybody have any questions? Or Katie, do you have anything you'd like to add? Okay. So in terms of the rate changes, the biggest change is going to, for most consumers, is going to be the loss of expanded APTC. In Oregon, although we didn't really see a big individual market growth when the enhanced APTCs were introduced and insurers tempered the rate impact that the expanded APTCs initially had on their underlying rates, consumers are going to see less APTC, and that's going to hamper their buying power. So even though right now the rates that I'm talking about, I'm going to say it was reasonable for us. We felt that they were reasonable rates for the underlying rate. We understand that the loss of APTC is going to have an immense impact on consumers, and I would just like to note that at this point. On the underlying rates, when you separate out the loss of APTC and its impact on the consumer's bottom line, we saw average rate increases of about 10%, I believe. And the contributions to underlying rate increases that consumers will experience outside of the loss of expanded APTCs are heavily influenced by the rising cost of care, or in some cases, the utilization of certain types of care. But really, in many cases, it's like the actual cost of care that is contributing to the underlying rise. And this included prescription drug costs, which some of my colleagues at the division work on prescription drug cost containment, as well as emergency room and emergency care costs. So generally speaking, the market outside of the changes to expanded APTC, we saw a relatively normal set of, or relatively customary set of rate filings. We didn't see anything that really stood out as concerning, that we had levers that we could have impacts on. The last thing I will leave you with before I turn it over to Katie is the that we have seen a kind of a consistent number of plans being offered and a consistent distribution of carriers operating across the state. So that is relatively consistent from last year. And hopefully that will give consumers who are trying to navigate the changes in expanded APTC and their premium a little bit more room to make some decisions. Any questions? Go ahead, Katie.
So I'm in two presentations today. I have this one and then also a presentation on federal changes. And so I had planned to talk about the AV stuff and federal changes, but we'll move it here. And so then when we get to federal changes, just remember that I've already talked about it. So as Tasha mentioned, those changes to the AV calculator and the actuarial value requirements did cause us some shifting. So it won't be apparent to consumers because it has happened all in the background. But we did have some, as Tasha mentioned, Pacific Source and Regions did have to make some changes to their plans because of that lawsuit. So that was an interesting exercise in how fast can carriers make changes, and we're really grateful to them for making all of those changes. So the things that consumers will see, though, are that Pacific Source is going to change their network this year. They were our last outstanding PPO carrier. They're changing to an EPO network this year. And because of that, they have to discontinue all of their 2025 plan IDs. And so when they do that, those consumers will be eligible for the loss of coverage SEP, which is, we always kind of refer to it as the technical discontinuance, because those consumers will be crosswalked to 2026 plans. If they don't do anything, they'll be auto-enrolled. But that is an extra protection for them. They'll have until March 1st to enroll in 2026 coverage if they don't do it prior to January 1st. Pacific Source and Regions added some new bronze plans. As Tasha mentioned, there are going to be a lot of changes this year, and we really encourage folks to go back and shop and see if there are things that are, that they'd like to make changes to. So highlighting that there are some new plans there. And I actually forgot Pacific Source does have a new silver plan. So again, make sure if you are a consumer or consumers, make sure they're heading back to shop. One of the federal changes is that all bronze plans are now eligible to be used with a health savings account or an HSA. And so in the past, the HSA was only available, you could only contribute to it if you were enrolled in a high deductible health plan. And that plan meant that you could not have any benefits that weren't preventive, that were ahead of deductible. So basically you had to pay your whole deductible before the plan would cover anything. But now you can contribute to an HSA account if you're enrolled in any bronze plan. So for folks who have been enrolled in those sort of traditional high deductible health plans, really encourage them to go out there and check out our other bronze plans that have a lot of pre-deductible coverage. So you could be getting office visits for $50 on a standard bronze plan and also contributing to that HSA account. There are, because this change happened mid-year, there are still those traditional HSA type high deductible health plans available. So folks will be auto-enrolled, crosswalked to those if they don't do anything, and those are still available if folks are happy with those, and they can continue to use those as an HSA account. Next slide, please. Our window shopping tool launched yesterday. It is available at oregonhealthcare.gov/window shop, and folks can go and it's an anonymous browse tool. So you just put in a little information about where you live and your household, and then it will provide you with an estimate of any tax credits that you might be eligible for. If you're eligible for Oregon Health Plan, it will also give you that information, and then you can see what plans are going to be available in your area in 2026. Consumers Checkbook is our vendor. They've updated the tool a little bit to meet revised accessibility standards. So if you haven't used it in a while, you may see some new colors and some new font sizes to help make sure that all users can use the tool. And then it continues to provide enhanced functionality over what we have on healthcare.gov. Our quality ratings are displayed. The formulary search actually searches carriers' formularies to tell you what the actual cost is for a drug. So really recommend that folks use that. There are sometimes real differences in how carriers cover different drugs. So if you take prescriptions, definitely check that out. It has a more reliable provider and hospital search. The hospital data is actually cleaned so that all of the hospitals are named the same thing that folks expect them to be named, so they can search that. And we just have a better provider search that has less room for error. We continue to have our gender affirming care section this year, just like we did last year. We also have a flag for our plans that have those 3 $5 office visits. And then we just have more information than what's on healthcare.gov, such as maternity care and imaging. Are there any questions for Tasha and I? All right, well, I think we're ready for our next item, which I believe is the break.
It is. I think we are supposed to break for 10 minutes. Just looking at this. Yeah, we were scheduled to be back at 10:40, but we're a little bit ahead. So what if we do, let's do 10:35? That work for folks? I'm proposing let's do it. All right, see you back then. Bye. Hi, everyone. We could reconvene here. Also, just thought I would share that if you're someone living, working from an office right now, those at home have an edge because I just got trapped in our elevator for 5 minutes. So, you know, fun times here on break. Let me just look at, okay. Katie, you're still with us, which is great. Okay. I see folks coming on video, so I think we can go ahead and get started.
Katie,
Can you come up? You're on mute still. Yeah, it's doing the thing again.
Dang it, Zoom. I was trying to see if Amy is on too, because Amy is actually going to have our first slide. So again, okay, I'm Katie Button, and I'm a Plan Management and Policy Analyst. And I'll let Amy introduce herself and take it away.
Hi, yeah, I'm here. I'm Amy Coven. I am the Marketplace Communications and Public Engagement Analyst. And Katie and I are going to talk about some federal changes, everybody's exciting favorite topic this year. So the first thing that we want to talk about is the federal changes that are impacting the marketplace starting this year in 2025. And that is the DACA eligibility. As many of you likely know, starting last year, November 1st of last year, DACA recipients were finally eligible to receive or to sign up for coverage through the marketplace. And the federal rules this year were updated to, again, restrict DACA recipients from being able to enroll in marketplace coverage. This also impacts, I just want to mention for posterity, this also impacts OHP bridge eligibility as well. The eligibility criteria did update on August 25th. So this did actually already take effect over the summer. Folks who are already enrolled through the marketplace were able to keep coverage past August 25th, but they were automatically disenrolled effective October 1st. So that was a recent update in the system. We were told that folks were receiving letters throughout the month of September, letting them know that their coverage would be ending. And another thing that whenever I talk about this topic, I always like to mention that, DACA recipients, although they're not able to go through the marketplace, unfortunately, or receive financial assistance, which is obviously a huge impact to affordability and access to coverage, we want to make sure that they're still able to access care. So we have given partners information about reminding folks about federally qualified health centers that are available around the state, and then also have given our partners information about the availability of DACA recipients to enroll directly through insurance companies. Although it would be without financial assistance, that is still an option that they have. And wanted to mention also that we have equipped them with information about the illegalities and the availability of coverage regardless of immigration status, and how to report any issues if that does come up. So trying to help our partners navigate this change with DACA recipients. We don't know how many folks in the marketplace are affected by this change. We did not receive a list of folks that were impacted or anything like that. Although, Katie, correct me if I'm wrong, but I think the last number we received from our OHP Bridge friends was there were about 75 folks that were impacted on the OHP Bridge side of things. So, so that's, I believe that's where that number was on that side. So I don't know if I missed anything there, Katie, but feel free to jump in. Otherwise, we can probably go to the next slide.
I think you covered it. Next slide, please. So there are a whole bunch of things that have come down from either House Resolution 1 or the program integrity rule that was released this summer. And so I'm going to go over them. I'm going to try to stay pretty high level. They get very wonky. So if you have questions at any time, please feel free to jump in. Dawn, can you take us to the next slide, please? Thank you. So the changes are happening over the next several years, which makes it a little difficult to remember what is happening and then also to try to mitigate those because people don't always remember what is happening what year. So these are the things that will be happening for 2026. So the first one is the ending of eligibility for people who have been in the US less than 5 years with incomes under 100% of the federal poverty level for tax credits. So we routinely refer to these folks as the 5-year bar population. So starting this year, they will not be eligible for tax credits on the marketplace. They are also ineligible for Medicaid. However, our state has the Healthier Oregon program, which is a Medicaid-like program that we fund from our state. And so these folks are eligible for Healthier Oregon. We do our best to route them directly to Healthier Oregon. So there are a few folks, though, who are on exchange. So hopefully those folks will finish that migration to Healthier Oregon this year so that they can still remain covered. There is a change to the premium adjustment percentage methodology. This gets very wonky, but basically it can impact things like the employer affordability percentage and some of the other percentages that are used for tax credit calculation. The change is it allows the federal government to basically offer people less tax credits and make that employer coverage more expensive. There is a change to the premium payment threshold calculation. So this is a calculation that carriers can do that allows them to cover people who haven't paid all of their premium. They could set a number that, people can pay up to X percent, or it can be a dollar amount. So there were some changes to that made it a little bit less flexible, but carriers can still have those premium thresholds. There were some changes in the ability of healthcare.gov to terminate agreements with agents. We're not too concerned about this in Oregon. We have pretty strict agent requirements, and we're not worried about healthcare.gov terminating our agents' agreements. Gender affirming care has been removed from the items that can be included in the essential health benefits package. For Oregon, this is a state law. It requires us to cover it. It requires it to be covered at the same level as other benefits. And so for our folks in Oregon, the change is basically kind of a behind the scenes thing with carriers and some of the ways that they file their plans, but consumers will still see those benefits. They'll still see them at the same cost sharing. And as I said earlier, they'll see them on our window shopping tools. So there's really no change to the consumer about that. There's currently a special enrollment period for people who have incomes of less than 150% of the federal poverty level. It's available all year. So it's basically sort of a rolling enrollment period. That's going to be paused for 2026. Most of our folks will be eligible for OHP Bridge at that income, and OHP Bridge does have a rolling open enrollment period. And so I'll just take this opportunity to stress that we really recommend folks come to our window shopping tool first before they go to either Medicaid or healthcare.gov. Our tool can more correctly off-ramp folks to Medicaid if they're eligible for Medicaid or OHP Bridge. And so if folks, especially if they think they're kind of close to that line, please come to our tool and use it, and then you can go where you need to go, and you're not going to fill out an application only to be told, oh, you need to go over here and fill out another application. There has been a policy that for folks who are enrolled in bronze plans who are eligible for a cost sharing reduction silver plan, that if the silver plan is the same price or cheaper than the bronze plan they're enrolled in, healthcare.gov would automatically move them to that cost sharing reduction plan. It would only apply to a very small number of Oregonians. I'm not actually sure any Oregonians were moved to silver plans under this policy. So this policy has been ended. So again, it would have only been available to a very small number of folks. So folks should not really feel any impact from that. And then, as I mentioned earlier, bronze plans are now considered high deductible health plans and can be used in conjunction with a health savings account. And that also applies to catastrophic plans, but we don't have catastrophic plans in Oregon. We haven't had them for several years, and I don't believe carriers have any plans to offer them. Next slide, please. So as Heather mentioned earlier in the Get Insured presentation, there was a lawsuit that has stayed several provisions that were in the program integrity rules. So those provisions are not allowed to be enacted until a judge has heard the case. So the first one is that change to actuarial value of plans that Tasha and I talked about earlier. There were some increased income verification standards. So currently, if people, if at application healthcare.gov can't talk to the IRS and figure out your income, people can just attest. And so the rule would have made people have to provide more information, but because it has been stayed, then it's currently in place that healthcare.gov will check with the IRS. If it doesn't match, consumers can just attest that that is their income, and healthcare.gov will move forward. There was also some increased verification for special enrollment period enrollment. So currently, if you go in and you have a special enrollment period, you're allowed to enroll in coverage, and then you have a time period where healthcare.gov can ask for more information if you weren't able to provide all of that at time of application. The rule would have made that so that you could not have your enrollment start until you provided that information. But since that provision has been stayed, then the process continues as normal, where folks go in, they apply for their special enrollment period, and their coverage can start while they provide that extra information. The last provision that was stayed is a provision that would have allowed states to decide whether or not carriers could deny coverage for past due premiums. Carriers can still deny coverage for past due premiums. Some of our carriers do, some of our carriers don't. And so that, because it was stayed, then the state doesn't have the option to decide, so that is going to continue as normal. Next slide, please. As we talked about earlier, the enhanced premium tax credits are set to expire at the end of the year. For Oregonians, for folks in between 200 and 400%, they'll see their premiums increase by $90 to $165. For folks over 400%, they will not be eligible. So some folks over 400% have been receiving hundreds of dollars a month in tax credits that they won't be eligible for anymore. So as Tasha mentioned, our overall rates actually haven't increased that much, but folks will see those higher rates. So again, we really encourage folks to use our window shopping tool so they can see what they might be eligible for, so they can be more prepared for open enrollment this year. Next slide, please. So in 2027, there will be some more changes. The first one is that the cap on repayment of APTC of tax credits is going to be removed. So currently, folks are somewhat protected from being responsible for overpayment of APTC. So if you report your income lower on your application than it ends up being at tax time, you're required to pay back some of those tax credits. That cap will be removed. And so this will be, this is for tax filing in calendar year 27. It applies to tax year 2026, which is generally based after application that folks will submit this fall, 2025. So it's very, very, very important that folks provide correct information at application time, and then that they report any changes to their income. This is especially important for folks who are close to the income limit for Medicaid or OHP Bridge. Those folks, if they report information that would push them into the marketplace when they should have had Bridge, they will be responsible for paying back all of those tax credits. So again, cannot stress enough how important it is to provide correct information at time of application and update your application at points during the year when your income changes. Plan year 2027 will see changes to the lawfully present requirement to remove refugees and asylees from that definition. So those folks will not be eligible for tax credits on the marketplace for plan year 27. They can still purchase coverage on the marketplace. They can still purchase coverage in the direct market. They just will not be eligible for tax credits anymore. And then the last change for 2027 is that open enrollment period requirements are put in place. Open enrollment, the entire period cannot be longer than 63 days. It must start no later than November 1st, but can start earlier, and it must end no later than December 31st, but can start earlier. A significant change is that if a state does have open enrollment go after December 15th, from the folks who enroll from December 15th to December 31st have January 1st coverage. Currently, those folks would have February 1st coverage. Next slide, please. In 2028, as Heather mentioned, there is an end of automatic re-enrollment. So currently we have about 33% of our marketplace folks automatically re-enroll every year. And so there is a box that they can tick on their application that gives healthcare.gov the authority to check with the IRS and make small updates to their income so that they can have their enrollment automatically renewed each year with appropriate tax credits. We don't know yet what that will look like to have the verification. CMS will have to provide more guidance on that. And then obviously we'll have to do outreach and education to consumers to make sure that they know that they need to come back in and do something active with their application, which will be a change from prior years. Next slide, and I'll send it back to Amy.
Thank you, Katie. So with all of these changes, we are really wanting to make sure that folks understand what the changes are, and not only what the changes are, but how they're impacting them directly. One of the challenges that I think that we're facing here in Oregon especially is that there are a lot of things that are being talked about on a nationwide level, and a lot of those changes, as Katie mentioned, aren't going to be necessarily impacting folks in Oregon directly. Things like gender affirming care and, auto moving people from bronze to solar plans, et cetera. Those are just not things that, because of how things have been going in Oregon, they're just not going to be impacting Oregonians specifically. So we have developed a number of communications and a number of different strategies to help folks understand what changes are coming down the pike and how those are going to be impacting folks. So first, we've had our insurance carriers have had communications going out. We have worked with them, and we've gotten communications from them about when they've sent their notices and what that text in the notices look like, so that we know, and our customer service center knows, what those look like and can help folks if they have questions. We've gotten some questions rolling in even from the media, from folks hearing about some of those notices being received and the impacts that those have had on folks. So we know that they're going out. We know that people are receiving those. As Katie mentioned earlier, we did make some updates to our window shopping tool to make sure that the costs and the coverage are accurately showing, and that folks are able to easily identify that information. In addition, on the 20th, we will be launching a consumer-facing blog and be sending out an email newsletter to folks, letting them know, just a quick hitting, this is what's changing, this is what you need to know for open enrollment to get ready, and hopefully helping people feel more prepared heading into open enrollment. And then we have a lot of just general open enrollment messaging that's going to be going out, specifically text messaging that is going to include some general messages about the expiration of the additional federal savings, making sure to encourage folks to use the window shopping tool and to revisit their application to update their information and to revisit their plan information to make sure that it's still a best fit, both for their health needs and for their budget. So we've got a lot of communications planned. Some of it has already started, and the rest of it will be kicking off on the 20th. And I think that was the last slide that we had for our section, but I know Katie, it's not speaking for Katie, but speaking for myself, I'm happy to take any questions, and I'm sure Katie is as well.
I am not seeing any. in the box.
I did want to just mention really quick, since we're just kind of hanging out waiting for questions. As Katie was discussing the enhanced premium tax credit expiration, I did drop in the chat. Wanted to make sure everyone saw the link to a document that we put together, which talks about the impacts directly to Oregon and folks in Oregon. We spent a lot of time putting that together, so hopefully you all appreciate it. I know we've had a lot of legislators appreciating it, so hopefully getting some momentum with that.
Okay, I do not see any hands raised, so we are probably good for the next slide. But because I missed this message earlier, again, see stuck in the elevator problem. I am late, but I wanted to welcome Acting Commissioner TK Keene to the group. Would you mind, if you're in a spot where you can just say a few words, would you mind just sharing anything you want the group to know, please?
Yeah, absolutely. Thanks, everybody. So TK Keene, Acting Insurance Commissioner. Been following this conversation for over 10 years now in various forums in terms of what we do around a state marketplace, and happy to join the conversation more formally. As many of you probably know, Acting Director Sean O'Day has been nominated and will go before a Senate committee in November for a confirmation hearing to become the permanent director of DCBS, and and plans to delegate the insurance commissioner title if successfully nominated to me. And so I plan to be part of this conversation for the foreseeable future. I think it's really been a great partnership with the marketplace and with carriers and consumer advocates in the offerings that get put forward and in maintaining this conversation. So happy to be here, and thanks so much for having me.
Thank you very much. And sorry I missed you earlier when you joined. Amy, did you want to move on into marketing?
I'm happy to. So hopefully y'all are okay with me continuing talking. Just wanted to give you a little insight into our marketing campaign for open enrollment. As always, we set our goals and intentions and objectives before we begin planning our campaign strategy and messaging. So just to highlight on what our goals this year are, of course, to maintain our current enrollment levels and also to continue efforts to close the uninsured gap, with a particular focus on retention this year, knowing that there are changes, especially with those enhanced premium tax credits set to expire at the end of the year. We've got 4 primary objectives this year. First, to build on the successes that we had last year by refining our creative and messaging to reflect and effectively reach our target audiences. What you'll see today in some sample ads that I'll show you is that we are keeping much of the same look and feel, just kind of refreshing and refining to update for the environment that we're in right now. We are hoping to build and increase trust with prospective consumers through segmented and highly customized approach that maximizes our paid media budget through trust building marketing channels. That's an objective that we consistently have from one year to the next. We are really focusing on rural communities and supporting non-English speaking audiences through any new and enhanced marketing strategies that we have, but especially leaning on the insights of what worked and what challenges we had for our campaign last year. And then, as always, integrating our outreach efforts to mitigate confusion and stress about changes to the marketplace plans and savings that folks are experiencing this year. Next slide, please, Dawn. So just for some of you who have been around for a while, you've seen some version of this before, but just wanted to make sure that everyone was refreshed to see that we do have the 4 personas that we built last year. We are continuing to carry those forward this year to really guide and plan our strategies for our campaign. these personas, the intention with these personas is to really reflect the different audiences that we're trying to reach, so that as we build our different campaign elements or strategies, we can reflect back on the personas and say, who are we trying to reach? Is this going to effectively reach our Casey persona or our Shay persona? And these personas are really intentionally created and crafted to really reflect the folks that we know that are maybe a little bit harder to reach, or maybe skew more towards the uninsured side of things, or may have certain, considerations that we need to consider in our messaging. So we've got Casey, who reflects kind of our older millennial, urban demographic. Mateo reflects our Hispanic, family-oriented demographic in Central Oregon. Shay reflects kind of our older demographic, just under Medicare age, maybe has some adult children. And then Charlie represents our rural, skewing male demographics out in rural Eastern Oregon. Next slide, please. So this is just an idea of how we use our personas to really assess audience trends and to really get an idea for what sorts of tactics we want to use, and how we want to specifically target each persona. So the goal that we have is to target the audience, not the channel. So we are not going into our campaign planning saying, we want to do, television or social media or radio, specifically, how are we going to use those? What we're looking at is we want to reach Casey. How does Casey, receive and digest information? How does Mateo receive and digest information? And as you can see, these different personas they do reach out and they seek information in different ways, depending on what's available to them. The darker the box, the more heavily that they receive information, or that they gather information through that method. So we are really working to maximize reach into where we believe to be the uninsured areas of the state based off of all the data we have available. So we do have some county level targeting. We are prioritizing high visibility transit placements, for example, in Multnomah County, out of home in rural areas, because we know that internet accessibility isn't always stable or available in those areas. Static creativity variations available for areas with low connectivity, so not always relying on videos, GIFs, short form and mobile first formats to make sure that we're reaching folks that don't have a computer at home, for example, and just really considering what channels are relevant, but also being mindful and good stewards of our dollars as well. Next slide, please. So this is just to give you an idea of the different tactics we'll be using. We've got the top row here, which is all pink. Those are all being handled by Color Wheel, which is they're our marketing placement firm that works with Quinn Thomas, which is our marketing firm. So they are working specifically with placing our ads for us. They are working with our video, which is going to be largely YouTube and connected TV, social media ads, online advertising, audio, and out of home. You will notice that for audio, we are not doing a lot of radio ads this year, and that's because we just found that folks are really leaning more into streaming radio than they are into traditional radio. So again, just based off of the metrics and what worked and didn't work last year, we're really wanting to be mindful of where we're doing our placements. The dark blue boxes are areas that Quinn Thomas are helping specifically. So we are leaning into online influencer partnerships again this year. We've been doing a little bit of that work outside of open enrollment as well to really hone in on how those campaigns can really benefit us on the marketplace side of things. And we've seen some really great results. So I'm really excited to continue those efforts, as well as providing toolkits for our partners and some earned media efforts, which includes working with our media partners. And then the yellow boxes are what we are really focusing on an in-house perspective. So our organic social media, again, leaning into Facebook, Instagram, and LinkedIn as we have in years past. Direct email campaigns, we do send a monthly newsletter, and then text messaging. We've got those all scheduled out to go through actually the end of January, and then again supporting all of our outreach events and sponsorships. Next slide, please. Wanted to give you a little bit of an idea about our messaging here. I'm not going to read all of this, but just wanted to give you our primary and secondary messages here. Really what we're leaning into is the fact that regardless of what's changing, health insurance is important. And that we at the Oregon Marketplace are here to help, and we are going to help get you covered, and we're going to be here to help regardless of what happens. So our creative strategy, we're leaning into the primary message is life happens, let's get you covered. And if we can go to the next screen here, I'll actually give you a little bit more information. These are some sample headlines and different images that we're using for our campaign. You'll notice that we're really emphasizing, life is unpredictable. So stitches after the game happens, we're pregnant happens, things happen that you may not expect, but also things happen that you are going to expect, like yearly checkups and prescription refills. And if we go to the next slide, please. See how it all comes together. So this is an example for a headline. This is all draft content. So we did, kind of did some edits and finalized it a little bit, refined it a little bit. But the primary copy is, you can't predict the future, but with the right health insurance, you'll be covered for anything life throws at you. And again, just reinforcing that the Marketplace, OregonHealthcare.gov, we're here for help. We're going to be able to connect you to local experts. We've got our window shopping tool. We're just really there to help, guide you and get you covered. Next slide, please. And then the last thing that I just wanted to show was some sample final ads. I'm really excited to share these with you guys. We are still in the process, just as I'm speaking, where our team is working on finalizing video assets and our Spanish ads. So that's why you're not seeing anything Spanish or moving here. But these are just some examples of ads and what they're going to look like. I'm especially happy or excited to see, I'm going to have to head to Portland at some time during our campaign, because I really want to see one of these bus shelters in real life. They look really cool. But yeah, you can just kind of see what it's going to look like on the side of a bus. We've got some bus ads that are actually going to take up the whole side of the bus, not just that little banner. And you can just kind of see the different kinds of imagery that we're using and messages. We're utilizing QR codes in different formats. We've got live buttons, and of course things move and bounce and things as well to make them more exciting. So we're just really, I'm just really excited about this year's campaign, and our video ads are looking really stellar as well. So just really excited to show you guys those once we get them closer to final. I think that was my last slide, but I might be mistaken. Oh, just kidding. We have one more. So as you know, there's a lot of work that goes into planning our open enrollment campaign. We've been working on this kind of in phases. So over the summer, we did a lot of strategic planning and development. We've been working a lot on creative development and production of all of our assets. We're finalizing all of that development this month, and we're getting all of our campaign implemented so that it's ready to go. Some of our assets will be going live actually, as we speak. Those are going to start going live to start getting folks ready. But most of our campaign will go live November 1st, and then they will go through, of course, January 15th, the end of open enrollment. We do have a final text message that will go out January 20th, just reminding folks to pay their premium, and if they haven't gotten a bill, to reach out to their insurance company. And then our marketing firm will work on some reporting and evaluation for us so that we'll be able to do some thorough evaluation of our campaign performance. That way we are really taking the results of what worked and, again, what challenges we may have faced this year. And we can hone in on what we're going to do going forward, especially with the changes heading into our state-based marketplace. So yeah, so that's where we're at right now. And again, I'm happy to take any questions if anyone has any.
I am not seeing any. Just gonna give folks a minute. Okay. Thank you.
Thank you.
I think we are at, next public comment. Did anyone sign up for the second one? I'm guessing no, but wanted to check.
No, they did not.
John. Anyone on the line who wishes to come off mute and make a public comment? Okay, then I think that brings us to the 26 work plan. Victor, do you want to take it away?
Sure. Sorry about that. A little lag there. So this is just as we do every year, a draft of what we have proposed for the committee's work for 2026. These would be sort of what we would see as stuff we already know in advance that we're going to be talking about or going to be dealing with. This, of course, doesn't include anything that may come up in between or other things that might go into an agenda as we go. But these, again, are kind of based on work that we already know is in progress and things that we expect the committee to be interested in and expect to provide updates and additional information during the year. So we've put this together. This goes April through, might actually have two of the months kind of switched around there, but I think the first month is supposed to be February. Yeah. At any rate, so as you can see, stuff we've already been talking about, what we expect to see for after open enrollment, the legislative bills of interest for the upcoming session in 2026. It's a short session, so we don't expect that to be necessarily as comprehensive, but there might be a lot of federal things to react to. 2027 open enrollment will be the upcoming open enrollment. And of course, a big part of that is going to be the updates we provide for our SBM project, and that'll tie in together with our open enrollment updates as we go. And then the OHP bridge, our interaction with them will be ongoing. Again, a lot of stuff that impacts us also impacts the bridge. And then the other business, again, this is sort of what we predict to be other business. So working on what we will see in 2027. And then we have our report from this year that we'll be going over next year. So I think, where it says February, looks like, Chicky, correct me if I'm wrong, it's supposed to be late May. Okay. So actually, if we could back up one slide, yeah.
Victor, I was just trying to explain that instead of April, it's supposed to be January, then April.
Gotcha. Okay.
And then July, October, and December. So we will be changing the months to January, then April.
That's okay.
Yeah, we will be adjusting this because we did finalize the meeting schedule after we've worked up this baseline work plan. So we will send out an updated work plan after this meeting just to get, because unfortunately, we did not update this after we finalized the meeting schedule.
Okay, so we'll put that back together. And these are the items that will be on the proposed schedule. The assessment we normally have in February, but I think we do have a different calendar for this. So it would start in January. Ordinarily, the meeting after is our assessment meeting. That's why there's only one checkbox in the second column. We've been moving that date that we talk about the assessment as the assessment has now become a little more complex with SBM project. So we're making sure we incorporate enough carrier feedback and also numbers from open enrollment. And then in January, again, that first column, we'll be talking about things like open enrollment debrief a little earlier than we normally would because open enrollment will end earlier this year. It will end December 31st. So so we'll talk about that in a moment. And then if we move on to the next slide, this was the proposed schedule. So you can see what we were talking about before. Our ordinary schedule spaces these apart 2 to 3 months apart, and then with a longer break between July and October for like a summer break. So this continues that. So we've got our January and our April meeting, which we hope to make in person, or at least have an option to be in person. And then planning to make all of our other meetings virtual only, unless the committee has a different preference. And then having, instead of that February timeframe for our assessment, having that in the spring. We do still need to do that early enough for carriers to incorporate that into their rate making. But we also want to make sure we have as much open enrollment information and our projections are as accurate as possible to make that assessment more precise, or as precise as we can get it. And then going on into our ordinary like middle of summer July meeting, and then October and December. So the meetings as they have been will continue to be from 9:05 to 11:55. And again, we'll be virtual for all these meetings, at least in our proposed schedule, except April, which we have it at the Human Services Building in Salem as we normally would. But that would be like there will always be a virtual option, but it's nice to get faces in the same room if we can, understanding that not everybody can do that. So, so that's at least the proposed schedule for now. And then moving on to the next slide.
I think we need to go back to can we go back to the work plan if we need to vote on that, please? Okay.
Sure, and I wasn't sure if, pending our rearrangement of the columns, this is at least the work that we have on the proposed work plan. So we were hoping to get at least either input or a vote or approval on that.
So just to reiterate, we're looking at January, late May, early June for that smaller one, July, October, and December. We're all on the same page on that, I think.
Lindsay, if I may, can we go to the next slide, please?
Sure.
So the schedule of meetings right now is January 15th. April 16th will be the in-person meeting, and then there will be a shorter meeting for the marketplace assessment rate in the spring, so targeting late May, early June. July 16th, October 15th, and December 3rd. So 6 total meetings for 2026. Sorry, I have to think about what year it is.
Yeah.
Six meetings for 2026 with a shorter one for the marketplace assessment rate.
And I dropped April, but April is the in-person one. I did not mean to drop it. That's the one where we'd love to see folks if you're able to make it, right?
Yes, please. And that's the timing that's been voted on by the HIMAC in years past as the best timing for everybody, and also the safest time in terms of weather.
Sounds good.
So if we can go back one more slide, please. So today what we are asking for is at least, regardless of the timing of when these topics will be covered, here are the kind of the general topics for the work plan for the committee. with, of course, a caveat that we can always add depending on what's going on with the federal landscape or even the state landscape. So we can always bring other topics based on what we hear as requests from the committee or hear as requests from staff and other community members.
Okay, any additional questions on this? Concerns, comments, general reflections? Okay. Kathleen, I see your hand.
Just a general reflection with the moving landscape of everything. I really appreciate all the work that you guys have put into this.
Thank you, Kathleen. We appreciate that very much. We try to be as nimble as possible, and we're still trying.
Yeah.
Someone else's hand is up and I cannot see who it is. Please.
Hi, yeah, it's me. Thank you, Lindsay.
Hi, please.
Considering what's happening at the federal level, I guess, have we done an assessment in terms of the impact, how many people are going to lose insurance? And by the way, great job in educating. Well, me personally, I think I learned a lot this session, but in terms of the impact, I guess, that we see happening in terms of people are losing their insurance because of all these federal restrictions or barriers are being developed.
So, okay, I'm gonna deep dive first, just because federal uncertainty has been happening pretty much all of 2025. So, as we talked about in the previous, I think it was in June when we had our marketplace assessment rate, the initial estimate of potentially reductions in the marketplace enrollee number would be around 4,000. That was kind of the initial analysis from the actuarial analysis that the Oregon Health Authority contracted with at the beginning of the year, and that's for EPTC expiration. Since then, there's a lot of other things that popped up. So it's changing pretty much every week. So it's really, really hard to predict at this time. So that's why this upcoming open enrollment, which is hopefully our last on healthcare.gov, will be very telling. So I wish we could tell you our crystal ball can give you a number. Yes, we've done our back of the napkin math. We've worked with actuarial services to see where we can maybe get a better number. And it is quite the year to predict. So that's why we are moving our marketplace assessment rate process to further in the year, just because enrollment is going to fluctuate and we just don't know what it's going to look like based on federal uncertainty. So, Marion, I'm really sorry. I wish we could have a better answer. We have guesses, and we don't know what that's going to really look like.
No. Trust me, I sympathize with your workload right now. I mean, I totally understand. Considering what's going on, you're doing great work, and it's unfortunate that so much chaos is being created at the federal level that really is hurting a lot of Oregonians. But thank you for your work, Chicky.
Thanks, Marion, and of course, in partnership with the Division of Financial Regulation, as Tasha presented earlier, it's been quite the year, and in partnership, of course, with our carriers, I think collectively, all of Oregon, we're trying our best to really figure out how to mitigate the impacts, try to make plans still affordable, and still give quality health plans to offer in the marketplace. So, open enrollment starts in 14 days, I think, if I'm counting right, 15 days. So keeping our fingers and toes crossed that it goes as well as we hope it, as the best as we can.
Other questions, other comments? I'm not seeing more hands. Chicky, do you think we're in a position to vote on the baseline plan?
I think so. And so if you would like me to take over.
Yeah, I think we'd need a motion to approve. If someone's willing to make that motion in a second, please.
Ron Gallinet, I'll move that we approve the proposed 2026 work plan.
Thank you, Ron. Is there a second from the group?
Kathleen Orrick, I second that.
Thank you, Kathleen. Any other comments here that we haven't captured? Okay. Chicky, if you'd be willing to please call the vote roll, that'd be great.
I would be happy to. Marion, how do you vote for the baseline work plan?
I approve.
Gladys, have you been able to join? And if you would like to vote? Stacy, how do you vote?
Approve.
Thank you. Charlie, is Charlie back? And how do you vote
Yeah,
for the
I'm back.
baseline work plan?
I approve.
Thank you, Charlie. Ron was first motion. Paul, how do you vote?
I approve.
Thank you very much. Lindsay?
Aye.
PK?
Approve.
Thank you very much. Kathleen was second motion. Claire Pierce Robel, are you still here? And how do you vote, please?
Still here, and I approve.
Thank you, Claire. How do you vote?
Is not present.
Okay. Nishoba, how do you vote?
Move to approve.
Thank you very much. And Joanne, how do you vote?
It looks like Joanne is not present.
Okay. All right. It looks like even with our three currently absent members or those who had to leave early, we have quorum, majority vote, and the vote for the baseline 2026 work plan is approved. So thank you all. We are going to be busy. It's going to be a fun year, at least a busy year.
Thanks, everyone. I think we're just moving into wrap up. Our next meeting should be Thursday, December 4th, 2025. Anything else, Chicky or team, for the good of the order here?
I think, of course, just flagging that our December 4th meeting will be a virtual meeting as well, same time, same place. It's still on Zoom. We hope to provide at least how open enrollment numbers are going. It really depends on how CMS will be handling things with the federal government still being currently shut down. So just wanted to flag also for us all that yes, there is a federal shutdown, but that does not impact healthcare.gov, as healthcare.gov and its kind of related operations is considered as essential functions. So that we still expect everything to go live as per usual. There might be just some delay in getting some enrollment numbers, and that's why I provided that caveat that as a topic for the December 4th meeting, we'd love to give you an open enrollment number, but that's all dependent on how quickly healthcare.gov team is able to share those numbers.
Okay, we'll see how it goes. Anything else to go to the order?
I think that's everything. Thank you, everybody, for your time today.
Thanks, everyone. Have a good rest of your fall. See you online in December.
Thank you.